Welcome to the show. Glad you're here. I've been really excited about this episode for a while. Thank you both for doing this, agreeing to do this. So, as we get started, introduce yourselves. Tell us what you do, where you work, how long you've been here.
Ladies first, Sherry.
All right. I'm Sherry Vautier. I am the clinical coordinator of the girls program.
Which girls program?
Ridgeview Girls ARCH Academy.
Thank you.
ARCH Academy, the Ridgeview Girls Adolescent program. This past April, we've been open for a year. So that was exciting to get a year under us. I have been with Cumberland Heights almost 13 years. I actually started out in the kitchen here.
What? I didn't know that. Really?
I did. I've worked almost every position on the campus.
Did you get an education along the way?
I did.
Interesting.
I did. I went back to school, got my degree to be a counselor. Also got my late act 2. So yeah, Cumberland Heights fostered all of that.
I didn't know that. Did you know that?
I did. Only because she said it once before and like another thing we were doing. And I was like,
what? Yeah.
I was like, she's lying.
That's awesome.
Yeah.
That's really cool. Who are you, sir?
I am William Branson, the clinical director for our boys program, our Harpeth campus, ARCH, Cumberland Heights. I have been with the youth program. August will make 9 years. It's easy to remember. My son was born like 2 weeks after I started working in the youth program, so I just use that as a barometer. But I did. I worked with Kay in when I was an intern for a year before I started over there
in the youth program.
No, that was program. With men's program when she was the relapse counselor.
So there's been a little bit of evolution at Cumberland Heights for those that know nothing about us, right? We used to treat adolescents here at our River Road headquarters campus from about 85 to 2020. There was an interruption there with girls. But then the boys moved to their own campus just down the road, about 20 minutes from here, officially, I think, in Kingston Springs.
Yeah.
And the girls officially in Pegram. Although, what's the distance? 2 miles? Maybe?
I go by minutes, about 5 minutes.
Yeah, about 5 minutes. So, probably maybe a mile, maybe less than a mile by the crow flies.
Yeah, absolutely.
So I love any chance to use that description. I am curious for you, Cherry. It's been a year. What have you learned? What has your staff learned? Because we've never done a girls' campus like this broken out, and we had to bring the program back.
I think for me, I've learned that I learn something new every day. That it's always changing. You walk in, you've got an agenda for that morning. You walk in and it is totally different by the end of the day. I think as far as staff, because a lot of my staff was working on the boys campus, they kind of trained over there because our campuses are very similar in the programming and all of that. So they trained there. So when we came over to the girls, they learned real quick that girls are different. They have more emotions. They are just, I wouldn't say all girls, because I've seen some boys over there too that, show their emotions the same. But I think for my staff, it's just learning how to relate. Because most of my staff on the girls' campus are girls, are female women. We do that for a reason, just so the girls feel more comfortable. But yeah, they just learn that it takes a lot more boundaries too.
Really?
Than with the boys. And the reason why I say that is because even for me, because I'm a mom of 3 daughters. So it's like sometimes it's like walking into my house back when they were all at home. You get the arguments, the disagreements, being stuck in the same room, just the same stuff that they, taking somebody's clothes, that kind of stuff. So it's just learning to not be the mom. It's learning to be the therapist or learning to be the clinical coordinator. So that, to me, that's been a learning for me.
So as you guys have been doing this together, because you were at the boys in another role, I believe as a family counselor?
Yes.
Were you there when we opened that campus in 2020, or you just moved over?
I think you guys come over in what was it?
It was April 1st.
April 1st, 2020.
So I came over in like June.
Okay,
Yeah.
but okay.
Yeah.
I was just, as you were talking, both of y'all have this wealth of experience with the girls now and boys. And when we say boys and girls, right, it's 13 to 17.
14 to, yeah.
13 is a case by case.
Yeah.
Yes.
Talk about that before we go any further.
Well, I mean, everything is really case by case. Honestly.
Talk about that.
Yeah. Well, we could talk about this all day. But everyone is a case by case. When they come in, you go through the admissions process, we get all the background information on you. And then depending on how that goes, that information then can go to the executive director, myself, medical team. Jerry, I see all of hers as well, because we want to make sure that the person that's coming in is a fit for us. One of the things I love about ARCH is that we are a nonprofit, and it's not just fill beds. It's make sure who's coming to us, we can help.
The right fit.
Yeah.
Mm-hmm. So is that our programming and the milieu?
Yeah.
So what does that mean when I say that for somebody that has like no idea? Maybe they're a parent with a child.
So will this child benefit from our programming?
Okay.
So
Right.
which is the most obvious part of that answer. Like, is what we do something that's going to benefit this kid? If not, let's find it somewhere else. Milieu wise, so we have 2 main cabins and then another cabin, but how are those cabin dynamics at the moment? And depending on that, where does this possible resident, fit possibly going into either of those? Will all this be beneficial for that possible young man coming in or lady?
Yeah, and that's the same with ours, except ours is 1 cabin. So, we've got to look at, depending on if we're getting full, we would look at, would this resident be able to come in and feel, because the main thing about ours is to feel safe. Like, we want our kids to feel safe and comfortable. If you're not safe and comfortable, you're not going to grow. And, we want them to grow and learn as they're there. So feeling safe is important. Feeling comfortable is important. So just making sure that, we can accommodate what they need, whether that's with their school, different variations of, what they may need for school. If we can accommodate like what they might need for the treatment work, that kind of stuff. So yeah, just making sure that they fit all around.
Yeah. Because y'all operate accredited high schools.
Yep.
Right. So residents, as you call them, that are still in grade school can continue in that work. And there's a lot of, as you kind of alluded to, there's a lot that goes into that, in terms of the transcripts and the all that admin burden. So I think that's something that's really unique about ARCH Academy and what y'all provide. I'm curious to, again, for somebody that has no idea anything about adolescent care or treatment or what y'all do, like who's an ideal resident and who might not be? And you don't have to get super granular, like just broad strokes, like severe mental illness is an example. But I'm just curious how you guys would describe that.
For me, when I'm looking at the boys program, it's anyone that I see that really the mental health completely overtakes everything else. Or maybe be to a level where they would benefit really just focusing on that. I'm also looking for behavioral issues that aren't tied with their use. So it's different if someone was under the influence and having behavioral issues. Like I fully expect that. Right. But if we're seeing things that jump off, the page that are just constant behavioral problems, across the board, then that's different, and that's not who we are either.
What do you think, Sherry?
Yeah, I agree. That's the same thing that we look for, and and sometimes you don't know the difference. when they come into treatment and, 3 weeks in, month in, when they, haven't had a substance, and then that behavioral stuff really starts coming out. And to me, when that becomes more prominent and instead of the substitute, then we would look for a better fit for them, and when they get that, then they can come back. So
makes me think about like assessment and the role that assessment plays, like, because you have some interesting factors that are mirrored in the adult population, but are also kind of distinct just because of development and the development time period. So do you guys, because sometimes I would imagine a resident or a kid, 16-year-old girl who might not and and maybe shouldn't receive some sort of diagnosis, right? Like dissociative identity, whatever it might be, comes into your program. And then, like you said, maybe you get a sense that there might be some other underlying co-occurring condition. How do y'all handle that? Because I know it's not just we refer out immediately. Like from an assessment perspective and a treatment team support perspective, like what would y'all do to try to help that person?
First of all, we also have outside providers that we work with that can come in and do assessments once they hit that threshold of, because again, like you said, you don't really know. A lot of these kids were diagnosed in active addiction, and it's kind of hard to get an accurate diagnosis during that time. So we have people that can come in and they can do assessments, they can do testing, they can figure out where that's at. A lot of us, though, just as, counselors, it's things we've learned and, different therapies that we use that it may work for this one, but it won't work for that one. So, we try all the way around to see what we could tailor to this particular resident, what may help them better. Because again, bottom line, we need them to learn and want them to walk away with something. If we can just plant a seed for them, then that can grow. So we work together as a team, the counselors, the teacher, because we have treatment team meetings. So we bring them in. We're looking at what that looks like as a whole person, because they're not just their addiction or not just their mental health. So we want to see them as the whole. So we'll get the whole treatment team together and say, okay, everybody will kind of put in what they see, and then we'll start talking about solutions to how we can do that.
So what is the goal of treatment at ARCH Academy? What do you hope these kids experience? What's the outcome? What's the rudder?
I want them to have a positive experience overall. Will it be rough at times? Absolutely.
Why would it be rough?
Because there's change. Yeah.
Change is rough.
Yeah, it sure is. And, we're taking away a coping skill that they've used, and that's how they know how to deal with all things, and are showing them new ways to do it. And that's difficult. And so I want to see, what I want for them is to see them kind of go through this statistical curve of, they come in as, they start to get escalated, and you start to see this because we're taking away that coping skill. And then you start to see it kind of come back down and level out as they start to implement these new tools that we give them. And then finally see them graduate, like start to see them gather all the things that they'll need so they can be successful when they leave. That's what I want to see. I kind of want to see that whole kind of progression.
But what do they need?
It's different for each kid.
I guess, what gets me curious about this question is, so ARCH Academy is a part of a legacy treatment provider that's grounded in 12-step recovery. And ARCH Academy is treating these kids. They're kids. They haven't even begun to really get into adult development. They're not hitting the adult development milestones yet. Yeah. So another, we could talk about adults that come to treatment are probably developmentally stunted, but these kids are like in process, the mold is being set, so to speak. And so like, what are those treatment goals? Like, is it abstinence? Is it, that's what I'm get curious about, how y'all think about it. I don't want to tell you what I think. So I've never ran a group over there.
So for me, what I see as a treatment goal for our kiddos is I want to see them Yes, be sober.
Sure.
And the thing is with the 12 steps is the 12 steps are applicable across the board. You could put anything you're struggling with in that first step and you can work all through the 12 steps. So it doesn't have to just be a substance. It could be anxiety. It could be my parents, it could be whatever that looks like. So it's teaching them the tool of the 12 steps and how to use that in everyday life, not just for their sobriety. But for me, the goal for them is, they're kids. Like you said, they're kids. When they come to us, they have no idea who they are. They usually started using around 12, 13, 14 years old. So they don't really know who they are. They don't know coping skills. So we want to teach them the coping skills. And I want them to learn who they are. Like they're a person. Who are you? What do you like? What do you enjoy? Like, just tell me your core values. Like, who are you? Because that's what they need to learn to be able to go out and be successful. Yes, it's the staying sober part, but if they can learn who they are, that's easier for them to do that as well.
Well said. Did these kids, I know y'all follow up with them after they leave your program and y'all have been working in these programs for many, many years. Where do you see, what are maybe some common struggle points when they get out of a program like Arch Academy and treatment altogether? Like, let's say after IOP 2, if they get there, like what happens next? Where do you see like that kind of potential rub coming from?
The one I see the most, and it's usually the soonest, is not sticking to the plan. I mean, honestly, and you know exactly what I'm talking about. From your family counselor days,
too, probably. Like I would imagine that's like the first thing that like is.
Yeah, I mean it's across the board. It's so before you you discharge or graduate the program, we do a reentry contract, and it covers everything. I mean, you name it, it pretty much covers it. And it talks about boundaries. What's going to happen if you keep those boundaries? What are consequences if you don't keep the boundaries? It's one of those things that they need to keep looking at. I always would recommend, once a month, let it grow with how y'all are doing.
This would be the family too.
Absolutely. Yeah. All of them together. And where I would get the most phone calls from parents of like, things aren't working, we're struggling. I would say, well, are you following your reentry contracts? And usually it was no, we haven't been following that. It provides an easy roadmap because the kid hasn't been in the house for a while. Things have changed, and it's a nice way to kind of transition back and keep things flowing.
Yeah, I agree. The family's a big part in that. When I did the family program, my biggest thing is telling the parents, you got to work your recovery too. It's not your kids' recovery. When they come home, they'll work theirs, you work yours. And it's following that. But also with our kids, again, you're falling in with, especially like the 16, 17-year-old. They go back home, they go back to school. What do they do on the weekends? Kids go out and they party. And so for them, it's like, they're like, I can't do that. But what if and I think after a while, they kind of let that creep back in, that thought of, well, it's just one. It's not that big a deal. So I think it's that, and it's, again, they're kids, that's a hard part. That is the social part. That is hard for them.
What's a day in a life at Arch Academy look like? And is it different across your programs? Similar?
Similar.
Yeah, I would say it would be because, we would be more like one cabin where they juggle too. But yeah, at ours, we have 2 groups in the morning. We have lunch, and then their day starts around, I guess it's about 6:30 because they eat breakfast around 7:30. So they're usually up and going by 6:30, make their beds, make sure their cubbies tidy, their room, breakfast, and they have school in the afternoon for about 3 hours. Then they also have rec time.
And for those that are listening too, like this is a classroom. Like yes. It is not like sitting in the living room. Like Check out our website. We have pictures. But like, like that's like a preconceived notion that maybe I've just heard. Like it looks like a classroom.
Absolutely.
There's desks and chairs, so that's where classes happen.
Yes. Posters on the walls.
Whiteboards.
Yes. It's the whole thing.
Classic.
All of it.
Posters, framed posters.
Yeah.
Yeah. I mean, our teacher's amazing. She is so good with the kids. She, everything's done on Apex. Again, though, that depends on each kid. Some kids come in and they stay with their school. Just depends on what they can do. Excited to know we had our first graduate already from ARCH Ridgeview. It was really good to see because she was not planning on finishing school. But she said her teacher.
Life-changing thing.
Yes.
Right?
I mean, that's everything. Like, that opened the door to where she had already shut the door.
Ooh.
So,
For real.
Yeah.
It just,
What changed? Why would she do that?
Probably our teacher. She made learning fun for her again. Because a lot of the kids, when they get there, they've been struggling and they're usually way behind.
Yep.
And they don't want to do it.
Right.
I'm too far behind. I don't want to do this. She sits down, takes the time with them, explains that, hey, we can catch up. We can even go further. You're going to be here at least this amount of time. As far as staff too, we kind of just keep telling them how important that is. And, school opens the doors,
door opener, yep.
And, hey, it's 3 hours a day.
You're going to be here.
Yeah, you got to be here anyway.
Let's just see what happens.
Yeah.
So what about the boys? Similar schedule?
Very similar. Between getting up, they have like a morning community that they do, morning chores.
Shout out chores.
Showers, all those kind of things. Because, they have to do their own laundry, which is usually one of those things that parents call and they're like, my child did what? He knew how to wash his clothes. It's like, or we'll teach him. And then, breakfast, and then it's group time. Each day the groups change, whether it's a counselor-led group, or we have outside providers who come in into an equine group, pottery, music, drumming, and then of course a lot of adventure. With that, whether it's on our ropes learning while we're on our ropes course, or on the river on a canoe trip, or fly fishing, hiking. I'm going to miss like a million things, but like all of those wonderful things, because, at this age, you have to do a lot of different things or it's just not going to work, and keep them active. And then it's lunch and then school.
That's
and then,
interesting.
Yeah. And then, or
like,
flip between cabins.
Boys, I'm used to seeing the boys physically moving throughout the day in a way like, let's move our bodies, no more insight. Let's take, let's play basketball that might turn into dodgeball, whatever. Do you see that part? Does that the same apply for the girls' population, like the physical movement, or are there other substitutes that go in that place for them from a day-to-day perspective?
We have all the same adventure stuff that he has. But they get to go outside more because they're in different buildings.
Right.
So for our girls, we may take them outside for a group.
Yeah.
Or if we have 10, 15 minutes between groups, we have them outside and we have them walk in. We walk down, of course, our 2 ponds on the property is amazing. Yesterday I did one of my individual sessions with one of our residents, and I took it outside and we fed the fish while doing our session. It just makes it easier.
Yeah.
They open up more whenever we're not sitting here staring at each other. So, we get out and do kind of things like that all the time.
Yeah. What, how popular are the groups with the residents? Like, I just have so many, do they love the drumming and then the counselor-led groups, or is it just depend on kind of the milieu and the topic and the theme? And
I think it depends on a lot. The resident.
Mm-hmm.
Yeah, I think it's the resident, because I've had guys who, it's hilarious. They're like, oh, I don't want to go to equine. Like when they first get in, they're like, I don't like horses on their own. And then by the next week, they're telling you which horse is their favorite.
Didi coming back.
Hey, when's equine? And I love Blizzard. He's the coolest horse ever. And, they're telling you everything about horses. Or I have some guys who really love DBT groups. We do a weekly DBT group with the guys.
Really?
They
guys, love that.
I've had a couple of guys who really like it, and they'll tell me about it and what they're learning.
Why do you think? What do they say? That's so curious to me.
I think it's just because it's helping them. Mm-hmm. Yeah.
Like there's like a framework, there's like a structure I can reference, there's a common language we can talk about now. It's not.
It's like, I was struggling with this. I have this new acronym that I learned and I tried it and it worked, and it's,
It's like,
what great.
Like, whoa,
exactly.
Like, I thought that this was something, it's those things like, I'm a person in recovery too. I know y'all know that. Like there's those things that you don't think about as a young person or as an old person, like when you're struggling with a problem, you're not necessarily, you're just experiencing that pain.
Yeah.
And so the first time that you experience some solution is kind of like exciting, whether you're telling somebody on a Southwest airline flight about it, or if you're telling your clinical director on your campus.
Yeah.
That's cool to hear.
Well, I think that's at that moment they start taking good control of things in their lives. They're like, oh, if I do this, I can control that. And they're like, oh, I didn't know I could do that because I used to just do this for it. So it's like in that moment, they're like, oh, I can actually be in control of part of my life. Like, and for them, it's been out of control for so long that I think that's, so they do. I mean, they do.
Like
I think
a novel discovery. Yeah.
Yeah.
And
it's empowering.
Yeah.
Because again, by the time they get to us, they've been told a lot of stuff. And, one of the bigger things is you're just a kid. You can't do it. Well, when they're learning in there, you're a kid, but you can do it. Like, this is all you. And that's what I tell my girls all the time. They'll say, thank you for your help or this. I'm like, I'm just along for your journey. Like, this is you doing the hard stuff. Like, I don't do the hard stuff. You do. You just allow me to be there.
Not to mention the identity work, I mean, deciding to change your life in this kind of way after going to treatment, whether that's, staying clean and sober or whatever your recovery means to you, is hard for anybody. And so, but I think about that pressure being 16 years old and like leaving your school and like, that's got to be really, really that, again, the word I'm thinking of is just that pressure, that social pressure of feeling, I can't believe I'm going to be that kid that's got to go to this place, to live for a couple months. And what's that mean for me? It reminds me sometimes, I think our adult patients out here don't know how to interact with like the love and the dignity and respect of Cumberland Heights. Like, what I mean is when somebody's being kind for just the sake of being kind and warm and welcoming, the response can be like, well, what do you want? Why are you doing this? And it's like, oh, we're here to help, like we just want you to have a good experience here. And they're like, no, but like, what are you getting out of this? And so, I don't know, that just reminds me of this unique struggle that these kids have to be under.
I think one of the biggest things that breaks my heart is kind of what you're talking about. When you hear the kid not feel like they're worthy enough to have somebody care.
Yeah.
I recently just had this with a resident. I told her, I said, I'm going to care till you can. So I don't need you to. I'm like, that's okay. You don't have to. And she would get so mad at me. And I'm like, I'm going to be here. Like, I'm still. And then it really was like, wow. I just yelled at you for 10 minutes and you're still standing here.
Yeah, right.
And I'm like,
that's not a thing. That's not like it's just something that you're modeling.
Yeah. It's like, it's not something, and she doesn't mean it. Like, it's not personal. It's hard. Like you said, most of them got here, and for somebody to actually care and care without strings. Like, I don't want anything from you. I want what's best for you. And like, do you really? I do.
Can I ask you guys about pace? You've reminded me of something. When I was a therapist, back when I was patient facing, when I was practicing, I had a few adolescent clients, in that age range. And I was always frustrated with pace because just like whatever, I'm an EFT training. That's kind of in the middle of my heart. So I like patterns, I like, core emotions, the process, not the content. It's very recovery too. We don't need to get into that, but I always noticed how much I struggled with the difference of pace with an adolescent. Like I'd be assigned an adolescent in this clinic and I would have to really coach myself up about like, all right, man, like today, if we just have a positive interaction for this hour, like that's and my supervisor was like, that's all you need to worry about. But I'm like, yeah, but I want to do I want to get in, like, let's figure out what the thing, like, like I want to generate some blah, 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 blah. And they were like, no, man, that's not what needs to happen for adolescents. So am I crazy and was just a bad therapist? Or is that a thing? Is the pacing sometimes different?
Oh, absolutely. Yeah.
Because y'all are looking at me like, you're like, yeah, we understand what you're saying.
Yeah, no,
like,
yeah, the pacing is absolutely different. And is
that frustrating? Or is that you guys are just pros now?
I mean, I'm definitely a pro now, but no,
absolutely frustrating.
No, it's definitely frustrating at times because we're all passionate about it. And you want and you want the best for these individuals, and you want to see them grasp it. But there's always that reality of, we're just helping them along. And what's going to make change is them doing this. And sometimes it takes longer for someone and not for someone else. And we also designed our program for that. So, yeah. So both programs are progress based. Yeah. And there's this whole program that we designed where it's a step process, it goes along with the 12 steps of how they progress through our program. And it's designed so that they do it at their pace and meet those milestones when they're ready and when they've been able to do the work or understand what they need to kind of get to that next level. So that helps as well.
I think the goals help with that too.
Yeah.
Like our treatment work, the step work is kind of, I shouldn't say set in stone, but it's kind of like the backbone. Now, then we go along with ours is like the goals, and those are very individualized to, like, if you have a kid that's struggling, like that's what's going on the goal sheet. Their struggles, like to help them in a positive way be able to, and if it's, even as simple as like not getting enough coping skills, like we may put on the goal sheet, hey, I need you to learn 3 new coping skills this week and use them and tell us about how that went. Just so they get in the habit of wanting to, because, different coping skills are for different people. They're all different. But I think one of my main things when I get frustrated, I have to tell myself, I meet them where they're at. They can't meet me where I'm at. So you take a step back and you're like, okay, this is, like you said, today, I didn't get yelled at. I am so excited. Like we went through that whole hour session and it was great.
It's real though. It is. For some people, it might be, like that is what you have to, I mean, like I said, it was something that I recognized early on that I really struggled with, because I wanted to push. And I also tend to be directive when I was practicing, right? If you can imagine, which works for some, it doesn't work for others and all that. We have to be reflexive, but it really challenged me to chill out and let them, like you both showed up on time. You were there, you were consistent. They're learning there's that trust element. Maybe they have had experience where they can't trust the adults in their life or whatever. All this leads me to think about how the structure of the program in terms of length of engagement really changed when y'all moved out to Harpeth. Can you talk about that? And maybe that this was connected. Can you talk about that evolution? Because it fundamentally shifted when you moved from River Road here to out there. Yeah.
Well, when we moved to our new campus, it allowed us to do so much more.
What was your original length of stay, you think, when you were here? Do you remember?
Oh, maybe 45 days.
Okay.
So back then, 100 give or take, dependent. Yeah. I mean, it's, and again, I think how we do our programming, having that campus and allowing us to do so much more is what really changed everything. And we were confined to doing things a little bit.
You're sharing a campus with other clinical teams, and other populations.
And
so you have to share the resources.
Yeah. And it was, the time you get for this or time you get for that is very, and you can only have so much. And but now it gives us the opportunity to do what we need to, when we need to. And that really changed everything. Yeah.
Definitely allows it to be more individualized.
Yeah.
Just like you said, progress based, because someone can get through it quicker than the other one, but the one that's slower not feeling it. They're just feeling, I'm here in my time. Mm-hmm. This is what I'm doing, and not feeling pushed or, like you said, pressured to have to perform at this one's level because they know it's all progress based. Just, we'll meet you where you're at.
How about your teams? What are you looking for when you guys are hiring a therapist?
I usually for me, I usually like someone who's just really passionate about adolescents. Mm-hmm. Mm-hmm. And that's not everyone. Yeah. There's just some people. And
thanks for saying
that. It's true. There's definitely people who...
just like couples is my jam, or individual is my jam, or whatever. Yeah. Yeah.
And usually you can tell right off the bat when you start talking to someone about it, whether they've had any experience working with adolescents.
Do y'all hire with no experience with adolescents?
I wouldn't say that I wouldn't. I think there's other variables that come into play.
Just that passion is what you're looking for.
Yeah. Someone who might be really passionate, loves maybe more wilderness-based techniques, and I'm like, okay, well, that's really cool. You can kind of tell when you're talking to someone too. I think you have to be a little bit more, I don't want to say immature working with adolescents, but I guess
not take yourself so seriously.
Yeah,
I think it's patience.
Patience. Yeah.
Thank you, Sherry. Flexibility.
Yeah.
Because things are not going to go according to plan here.
Absolutely not.
Mm-hmm.
Interesting. Have we ever, I am genuinely curious, do we hire folks out there that haven't worked in adolescent care specifically? And what's that like for them getting in tune with our population and programs?
Oh, I have. I can answer that. I was like, yeah.
Maybe it didn't work out.
No, I did. The individual was, for their own reasons, was really passionate about adolescent care. They got sober when they were an adolescent. And that's when I say when there's those other variables of someone who maybe not necessarily has been working with adolescents for, a year or so, but has all these other things.
Well, we have staff move over too.
Yeah.
Back and forth, right? And I don't imagine that every time somebody's been inside of a adolescent program, they're just hey, I believe Kenny used to be here at River Road.
Yeah, he was, because he and I started a day apart.
Oh, really?
Yeah. I've been here a day longer.
And so that was an example of passion, really excited about one particular element. And I think Dean and y'all's team recognized that and let him really run with it. And he's done such a great, great, great job.
Yeah.
But yeah, it's just always just fascinating to me of how we build those teams, and people are good at some things and they have, expertise in others. And I just would imagine that sometimes it can be difficult to find somebody that hits all the checks.
Yeah.
I think it would be. I think for me, it's the passion too. You have to be passionate about the kids, but then you also have to understand that piece of recovery that comes in because it's different than just a private practice adolescent. Because they're coming into us with a lot of factors. And, some of the biggest factors is parents. So it's being able to work with families, which I love families. That is my passion. So it's being able to fit all those pieces together. But again, I think, because on the girls, it's I have one counselor. So it's a lot different. So my team looks different versus I rely on my CAs a lot. And even my teacher, she led a group for us a couple of weeks ago. Girls absolutely loved it. So it's different. But like when I was on the boys campus, I think for me, it's a team to me is like you said, everybody has things that they're really good at. And you come together and you help with the things you're really good at, and you let others help you with the things you're not as good with. So it's being able to just talk. To me, a team player is important when it comes to this kind of work, because it takes all of us for each resident. Like, it's not just, oh, this is the one I'm working with. It's like, oh no, you have 12 others over here.
Yeah.
So it's being able to, be flexible and be with all of them.
Yeah. In our organization too, like sometimes you have to boil the water and sometimes you add the salt, sometimes you clean the pot. Like that's part of what we do that I really enjoy, because on any given day, things could be totally different. You could be doing something totally, and that makes it exciting. In the midst of like underpinning all of that is somebody's searching to change and live differently.
Yes.
Okay. Where is Arch Academy going? What's next? What are y'all most excited about? Like, maybe you can't think about what's happening next week, but like next year, 5 years from now, what are y'all excited for?
Can I say getting through the day?
Yes, you can.
No, I'm excited to see it grow. Like our girls program. Again, we're really new, but I know with our program, it's not a lot of places out there. Of course, I may be biased, but I love Cumberland Heights. I love their mission. I love why they're here. And I love how the girls, we walk into our facility and you're like walking into a cabin. And that's just that feeling. So, I want to see them grow and be able to, help more girls out there. That's ultimately what I would like to see.
What say you, Will?
I'd say growth the same way.
I mean, you guys have been doing a lot with IOP. That's something I think about.
And growth with being able to reach more people. Growth in what I think you always need to be evolving, right? And so I mean that as well. Like you always need to be changing and always, making yourself better. Like, what can we do this year that makes us better? What do we need to provide more of? What can we, what are we not providing that we can provide? And I'm also always pushing our executive director for like, hey, maybe we should add this. I always want to add, right? Like, let's add this cool group. Like recently I heard about a group for, was it like some game group? There's this, I don't know much about it, but like game therapy or something. And they were like, we provide this game group. I'm like, awesome. I want to add that. So just always growth and evolving. And like you said, growing maybe to more IOPs, more areas. Yeah.
Yeah. I just think there's a huge, you alluded to it, adolescent care, period, full stop, is something that's needed more than ever. Just with in my opinion, the impact of technology and social media, like, don't get me started. It's really important developmentally. And I think that's what I love about what y'all and Dean are doing, growing that outpatient arm of the service. Like, and if you're not careful, like, be careful what you wish for, because the girls are here for a year, and sometimes at Cumberland Heights, it feels like change happens really slow. But other times, and the reality is change is happening all the time.
Yeah.
And y'all probably have that perspective, having been here for a while, to see like how much has changed. Like a tremendous amount has changed as an organization. And it does excite me to think about that on the outpatient side, where the severity is different. And more than likely, that means more lives touched. Because, usually that's a bigger population, and maybe we could do some cool things in the community at that level that could interrupt. I think about it with my own story. I don't know if I would have listened, right? I was just on the runaway train, but for some kids, there might be something that you guys do, like that game group at the outpatient level, that could change their life.
Yeah.
So that excites me. And we've had these adult programs for 60 years, we adolescents since 85, but like that's a real opportunity. And you're right. There are not a lot of in-network, not-for-profit providers in Nashville or in Tennessee or in the Southeast.
Yeah.
So it is kind of just exciting to see all that move forward. Well, shout out to y'all. Shout out to your programs. If you're interested in learning more, check out their program at arch.org. Again, we have a boys program. We have a girls program, 2 distinct campuses. And we have IOP both here in Nashville and soon in Memphis, and telehealth. So anywhere in the state of Tennessee, we'll have these guys' bio and contact information in this week's episode. Thanks again for listening. Give us a like, follow, and share. We'll see you again next time.